And then for the last nasogastric procedure, which is the removing of the nasogastric tube, it is to promote comfort and prevent trauma of the gastrointestinal tract.
And then now we have the materials that are needed in the procedure. The first materials that we're going to need is tissues, normal saline solution for irrigation. This is optional only. Bath towel, which is already in the towel or disposable pad. Clean gloves, which are already worn. And disposable, make sure to also have a disposable plastic bag, which you are going to throw your trashes after. Then after the disposable plastic bag, you need a 50 ml syringe, which is very optional also, which we do not use since we're going to remove now the nasogastric tube in the patient.
As a nurse, we are following the basic guidelines of the nursing process. So for our assessment, we're going to check for doctor's order for the removal of the tube, and then check for the presence of the bowel sounds and for the absence of nausea and vomiting when we clamp the tube. And then for the planning, we are going to plan due to the need for assessment of client status, the skill of removing the nasogastric tube which is not delegated to untrained personnel. And then make sure to gather your equipment and material.
So for the implementation of the procedure now proper, same as the previous procedure, introduce yourself and verify the client's identity, explain the procedure to the patient to let the client understand, perform hand hygiene and don gloves, then provide the client privacy, assist the client in a sitting position in health permits, place the disposable pad or towel across the client's chest to collect any spillage or secretion from the tube. Make sure also to provide tissues to the client to wipe the nose and mouth after tube removal. Make sure to detach the tube. So in detaching the tube, make sure we have to disconnect the nasogastric tube from the suction apparatus if there is or present. Then now you can unpin the tube from the client's gown. Okay, now which you have seen, which after I'm wiping the patient and you unpinning, and then remove the adhesive tape securing the tape to the nose. And then remove the nasogastric tube by putting on the gloves and ask the client to take a deep breath and to hold it. Pinch the tube with gloved hand. Smoothly withdraw the tube. Place the tube in the plastic bag. Observe the intactness of the tube. Ensure the client's comfort. Provide mouth care if desired. Assist the client as required to blow the nose. Then dispose now the equipment appropriately. Place a pad bag with the tube and gloves in the receptacle after you have done, and assist the client in the comfortable position as always.
And for evaluation, we have to evaluate the tolerance and the response of the client to the activities, and make sure to record also the removal of the tube, the amount and the appearance of any drainage if connected to the suction, and any relevant assessments of the client. And then lastly, for the documentation, make sure to document all the relevant information. So nursing management of the patient with NGT. So before we end, so number 1 is to provide a patient as much comfort as possible. Make sure also that all of the tubes should be properly cleaned before and after feeding to remove crystals that later form into dried mucus. Also, make sure that the teeth of the patient should be brushed even if the patient is not eating to prevent bacteria action in the mouth. And then provide anesthetic lozenges and gargles to prevent sore throat from the presence of the tube. And lastly, number 5, frequent oral hygiene will also increase the patient's comfort by removing debris and stimulating salivation. So that's the nasogastric procedure. That will be all. Thank you so much and God bless.